When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite. Obey your thirst.
This episode is brought to you by Indeed. You're ready to move your business forward, but first, you need to find the right team. Start your search with Indeed-sponsored jobs. It can help you reach qualified candidates fast, ensuring your listing is the first one they see. According to Indeed data, sponsored jobs are 90% more likely to report a hire than non-sponsored jobs. See the results for yourself. Get a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
Hi, everyone. This is Dr. Ted O'Connell with the Med Prep to Go Step 2 podcast. Today, we'll be reviewing 3 cardiovascular questions. Just a reminder that you can find these questions on our website at medprep2go.com, along with many other questions in a Qbank that is continuing to be developed. If you have feedback or you'd like to get involved in contributing to this free online and audio question bank, please contact me at ted.medprep2go@gmail.com. Just a reminder that if you like what we're doing, please subscribe and also consider giving us a review and telling your friends about the podcast and the website. All right, let's get started with the first cardiovascular question. A 49-year-old man is evaluated during a health maintenance visit for his type 2 diabetes mellitus and hypertension. Current medications are metformin, empagliflozin, chlorthalidone, and candesartan. The patient had an ACE inhibitor-induced cough, which is what led to the candesartan being prescribed. On physical examination, vital signs are normal. Body mass index is 25. Triglyceride level is 195 milligrams per deciliter. His 10-year risk for atherosclerotic cardiovascular disease, or ASCVD, is 4.2%. After a thorough discussion concerning the various cholesterol guidelines, the patient agrees to follow the American Heart Association and American College of Cardiology recommendations for cholesterol management. Which of the following is the most appropriate treatment? A, high-intensity atorvastatin, B, fenofibrate, C, moderate-intensity rosuvastatin, D, red yeast rice, or E, cholesterol? The correct answer is C, moderate-intensity rosuvastatin. Primary prevention of cardiovascular disease in a patient with type 2 diabetes mellitus with statin therapy is recommended based on 2 major guidelines, which are the American Heart Association and American College of Cardiology recommendations, and the U.S. Preventative Services Task Force recommendations. The AHA-ACC recommends initiating moderate-intensity statin therapy in adults aged 40 to 75 years with diabetes mellitus, regardless of the calculated ASCVD risk score. The United States Preventative Services Task Force recommends that adults without a history of cardiovascular disease use a low to moderate dose statin for the prevention of cardiovascular events when all of the following criteria are met. Number 1, they are 40 to 75 years of age. 2, they have 1 or more cardiovascular disease risk factors, such as dyslipidemia, diabetes, hypertension, or smoking. And 3, they have a calculated 10-year ASCVD event risk of 10% or greater. So it's just important to realize that this question was specifically asking about the AHA-ACC guideline, which are the most frequently utilized set of guidelines and are really the ones that you should be focusing on for your preparation for USMLE Step 2. Okay, second question. A 58-year-old man is evaluated during a routine visit. He has rheumatoid arthritis and hypertension. His mother had a myocardial infarction at age 53 years. His current medications are methotrexate, folic acid, losartan, and amlodipine. Vital signs are blood pressure, 138 over 80 millimeters of mercury, pulse 72 beats per minute, respirations 12 per minute, oxygen saturation 98% on room air. He is afebrile and has a body mass index of 27. There are no other pertinent physical findings. A lipid panel and hemoglobin A1C results show that the hemoglobin A1C is 5.6%, LDL is 162, HDL 38, triglycerides 275, and total cholesterol is 164 milligrams per deciliter. The patient's 10-year risk for atherosclerotic cardiovascular disease is 14.2%. In addition to therapeutic lifestyle changes, which of the following is the most appropriate treatment based on the American Heart Association and American College of Cardiology, also called AHA-ACC recommendations, as well as those of the United States Preventative Services Task Force? A, ezetimibe, B, gemfibrozil, C, alirocumab, D, high-intensity atorvastatin, or E, moderate-intensity atorvastatin? The correct answer is E, moderate-intensity atorvastatin. Adults aged 40 to 75 years without diabetes mellitus and with an LDL cholesterol level of 70 milligrams per deciliter to 189 milligrams per deciliter should undergo risk assessment for primary prevention of atherosclerotic cardiovascular disease, or ASCVD. The 10-year risk for ASCVD can be categorized as low, or less than 5%, borderline, which is 5% to less than 7.5%, intermediate, which is 7.5% to less than 20%, and high, which is greater than or equal to 20%. In adults at intermediate risk, the presence of risk-enhancing factors may justify initiation of moderate-intensity statin therapy. This patient has two risk-enhancing factors: rheumatoid arthritis and a family history of premature coronary artery disease. The AHA-ACC recommendations for primary prevention of ASCVD support moderate-intensity statin therapy for this patient, given his ASCVD risk is above 7.5%. The United States Preventative Services Task Force recommends low to moderate intensity statin therapy for primary prevention in adults who have at least one ASCVD risk factor, like dyslipidemia, diabetes, hypertension, or smoking, and a calculated 10-year ASCVD risk of greater than 10%. The key learning point of this question is being aware of the two major guidelines that influence the management of hyperlipidemia for primary prevention of CVD is helpful for the USMLE Step 2 exam. And I would personally recommend that you focus on learning the AHA-ACC guidelines. Specifically for this question, in a patient who has an ASCVD risk of 7.5% to less than 20%, the AHA-ACC recommends moderate intensity statin therapy.
In Walmart's Newville, time was ticking away. Only a few nights left till the big holiday. But last-minute gifters had no need to worry. Walmart Express Delivery got their gifts in a hurry. From Nintendo to Nespresso and Lego flowers, they could check off their lists in as fast as an hour. All of Newville, East, West, South, and North, could order gifts up until 5 p.m. on December 24th. So this holiday, just do as the Who's do. With gift delivery this fast, they all gasped. From Walmart? Who knew? Subject to availability, terms and fees apply.
Oh, Hilton Stay, your beds are soft and cozy. No lumpy couch, no stiff futon, no shower line at crack of dawn. Oh, Hilton Stay, a holiday you're saving.
When you want holiday comfort you can count on, it matters where you stay. This season, enjoy spacious, comfortable rooms and friendly service when you book with Hilton instead. Hilton for the stay.
Question 3. A 10-year-old boy is brought to the office with a chief complaint of whole body aches and stomach pain that have progressively been getting worse over the past 3 days. He reports a sore throat, which has made it difficult to swallow. His past medical history includes a few cases of the common cold and an ear infection. He had previously been seen at another clinic a month ago for his sore throat, which was diagnosed as a viral infection and thus went untreated. He is not currently on any medications. His temperature is 100.2 degrees Fahrenheit or 38.8 degrees Celsius, with a pulse of 125 beats per minute. Physical examination shows a normal pharynx. On cardiac auscultation, a murmur is heard over the mitral valve area, as well as a friction rub. He is admitted to the inpatient setting for further assessment. An echocardiogram shows pericarditis, but no other structural abnormalities. His blood work shows increased white blood cell count, an elevated C-reactive protein, an elevated erythrocyte sedimentation rate, or ESR. He is started on long-acting intramuscular penicillin G benzathine to treat the suspected causative agent. Secondary prophylaxis with antibiotics is used to decrease the risk of which of the following complications? A. Erythema marginatum. B. Migratory arthritis. C. Pneumonia. D. Rheumatic heart disease. Or E. Sydenham chorea. The correct answer is D. Rheumatic heart disease. This patient has acute rheumatic fever, or ARF. If left untreated, ARF can progress to rheumatic heart disease, which can lead to permanent heart damage, such as valve stenosis, valve regurgitation, and damage to other cardiac tissues. This patient has evidence of cardiac involvement. Rheumatic heart disease becomes more severe with each recurrent episode, so the most effective method to limit progression is prevention of recurrent Group A streptococcal pharyngitis. The diagnostic criteria for ARF include 5 major and 4 minor manifestations. These are called the revised Jones criteria. The 5 major manifestations are arthritis, which is usually a migratory polyarthritis predominantly involving the large joints, carditis and valvulitis, central nervous system involvement such as Sydenham chorea, subcutaneous nodules, and erythema marginatum. The 4 minor manifestations are arthralgias, fever, elevated acute phase reactants, and a prolonged PR interval on electrocardiogram. Answer choices A, B, C, and E are incorrect. Although answer choices A, B, and E are aspects of the Jones criteria, these are manifestations of ARF and are not prevented with antibiotic treatment. Answer choice C is also incorrect. Pneumonia is not a complication of acute rheumatic fever. The key learning point here is rheumatic fever is an inflammatory sequela of infection from Group A streptococcus, or GAS. This is primarily a disease of childhood and adolescence. Inflammation occurs because the M protein of Group A strep causes a type 2 hypersensitivity reaction where antibodies are made against the protein. These antibodies can cross-react with proteins in the body, leading to complications described in the diagnostic survey called the Jones criteria. Each letter describes a major criteria that can be used to diagnose rheumatic fever. J for joints, O for obvious heart damage, N for nodules, E for erythema marginatum, and S for Sydenham chorea. Minor criteria include arthralgia, fever, increased acute phase reactance, and a prolonged PR interval on electrocardiogram. The presence of two major criteria, or one major and two minor criteria, with positive evidence of group A streptococcal infection can be used to diagnose acute rheumatic fever. Okay, so that's it for this episode, but please do check out our other episodes. And remember that you can find these questions and more over at medprep2go.com. And if you find the content of these questions to be useful, please do check out the USMLE Step 2 Secrets podcast.